For a variety of reasons, there are multiple treatment options for ankle injuries. Those treatment options range from relatively inexpensive to custom orthotics that are on the more expensive end of the spectrum. There are multiple benefits and positive outcomes of the variety of treatments at hand for certified athletic trainers to employ. However, there are treatment outcomes that have been shown to have little or no significant alterations based on those selected treatments. The purpose of this concept map is to outline several ankle injury treatment options, which are elastic ACE bandages, proprioceptive neuromuscular facilitation, taping, and lace-up and custom braces, as well as the rationale and measurable outcomes for each of these treatment methods. We're going to start with elastic bandages. Elastic ACE bandages are one of the least expensive treatment options for injuries, specifically at the high school, when they can be laundered and reused for an extended period of time. Kirchhoff's et al. Article examined the treatment outcomes between elastic bandages, tape, and semi-rigid bracing supports. The researchers conducted 9 trials, and they had a total of almost 900 participants to compare the previously stated treatment plans. Elastic bandages were reported to be associated with a slower return to activity time, whether that was work or sports, and were ineffective in decreasing the number of days or restricted from activity. Elastic bandages improved overall ankle functionality, but had no significant impact on reducing inflammation or supporting the ankle during exercises designed to return to participation. Research has shown that comparatively, elastic bandages are the least effective treatment of ankle injuries when in comparison to lace-up or custom braces, as well as a tape application. Although this option is by far the least expensive, as a clinician, it is important to identify that it may not be best practices to apply this treatment to a patient who is weight-bearing and participating in functional activity to return to play. It applies the least amount of support, so indications of other treatments should be utilized once a patient is full weight-bearing. Lace-up bracing, specifically the semi-rigid style, was the most impactful on decreasing the number of days out due to injury. The most optimal variation of a lace-up brace in both quality and cost was also the semi-rigid type. However, several studies concluded that there was no significance of affecting the inflammatory rates in ankle sprains. Research, however, did conclude that other variations of lace-up braces had a significant decrease in the amount of inflammation seen in ankle injuries. Lace-up braces are considered to be economically friendly option on a budget for the cost compared to the overall duration of the lace-up braces that can be utilized. Research has also defined that they are traditionally the go-to option at the high school athletic setting, specifically with patients who have had a previous history of lateral ankle sprains. This could be due to an overall cost effectiveness or the treatment option of most seasoned certified athletic trainers are comfortable with. As a comparison, lace-up braces have also been shown to be more clinically appropriate when compared to elastic bandaging, specifically in short-term effects on inflammation and support of the injured joint. One of the more expensive options is custom braces or orthotics that can be utilized to treat ankle injuries, specifically sprains. Custom braces, although initially expensive out of pocket, the durability, the support, and the increased longevity of the treatment make it possibly one of the most economically friendly options over an extended period of time. This would not be the case if treatment and rehabilitation of an ankle sprain lasts only days and does not require additional support during activity post-injury. If a patient is going to need additional support for an extended amount of time, a custom-made brace will be the most beneficial and cost-effective option to employ. Research shows that custom bracing has had significant impact on the reduction of inflammation post-initial injury when compared to semi-rigid lace-up braces. This is more than likely because it is molded to the patient's specific measurements and allows for optimal ankle functionality. As clinicians, we all know that optimal ankle functionality during activity should be a priority. Custom bracing has also been identified in the literature to improve overall ankle functionality during the use of braces in activities. Although lace-up bracing has traditionally been selected as the option for patients with a history of lateral ankle sprains, Verhagen and Bay concluded in their research that custom braces were the most optimal method of treatment. As a clinician, we see those patients with previous injury to a localized area are more predisposed to injury, as well as an increase in severity of future injuries. This is usually due to a decrease in tensile strength of the injured ligaments. Custom bracing can provide that ideal level of support while concurrently increasing the ankle functionality. Evidence has also concluded that custom bracing, in conjunction with an increased shoe height at the ankle joint, has been beneficial to the treatment of ankle injuries, specifically sprains. The same literature also identified that an increased shoe height in conjunction with a closed basket weave ankle tape has also been beneficial for treatment of ankle sprains. As a clinician, there is no evidence to suggest that based on these factors alone, one is more beneficial than the other. Therefore, selection of a treatment should be based on cost as well as patient preference. Over an extended course of time, consistent treatment with tape is more expensive than a treatment option that is reusable and supportively consistent with little variation. In addition to an increased cost, repetitive ankle tapings can have implications such as skin irritations or blister formation. However, if strength training exercises are completed simultaneously during the treatment protocol when taping is administered, the literature suggests that the training reinforces the support and overall goals of the tape job. As a clinician, tape is often the most preferred method of patients in the athletic setting, specifically at the high school level. Supportive devices are limited in the progression of treatment regarding ankle sprains. Proprioceptive neuromuscular facilitation should be integrated into the treatment plan to increase the benefits of any supportive device. If PNF exercises are conducted concurrently with strength training exercises, literature suggests that benefits of both treatment methods increase significantly and can decrease the overall days limited from activity, whether that's work or sports. If patients have a previous history of ankle injuries, specifically ankle sprains, that were not treated medically, PNF exercises are optimal for treatment of those recurrent injuries. Scar tissue quickly binds down to an injured area during the phases of the healing process. If there is previous injury to the ankle that is not treated medically, introducing PNF activities can begin to break up the adhesions as well as support the lymphatic system in removing extracellular fluid and blood that could be localized to the area. We also know that doing these exercises in a gravity-dependent position can also work against the lymphatic system. If PNF exercises are able to be completed in a gravity-eliminated position, support for the lymphatic system also increases. Support for the lymphatic system helps remove the extracellular fluid and the blood that could be localized in the area. Ankle functionality has also been identified in the literature to be significantly improved with the introduction of PNF exercises. PNF exercises and custom bracings have both been identified in the literature to prevent and reduce the occurrence of recurrent ankle fractures or injuries. Specific to the literature is ankle sprains. This is clinically significant for certified athletic trainers, as prevention of injury is our #1 responsibility. Although this presentation briefly mentioned patient preference in treatment of ankle sprains, there is a lack of literature to support that patient preference should be a primary factor in the selection process. As clinicians, we should practice in an evidence-based method, which vitally includes the patient's specific preferences. If a patient has a previously negative experience with a specific treatment option, such as a rigid, semi-rigid, or lace-up brace, they may be less confident with the selection of that treatment option and lower their trust and confidence in their healthcare professional. The patient's psychological confidence in the treatment plan and the professional selecting that treatment plan is crucial to its overall success. If there is any uncertainty in either the treatment selected or the professional who is selecting the treatment, it could inversely affect the measurable outcomes. There is also the question of when does patient preference outweigh the known benefits or harms of a particular treatment. Future research should be conducted to include patient preference to determine how high of a priority patient preference should be considered when selecting a treatment plan. I hope this presentation has identified insights into which strategies are the most effective in treating ankle sprains, specifically in high school athletes. Optimistically, I hope you employ some of this knowledge and supportive literature during your next treatment session of a high school student athlete's ankle sprain.